This presentation includes post-operative instructions for patients recovering from a total knee arthroplasty performed at Cadlick Regional Medical Center by Dr. Jake Stanfield. Recovery can be challenging and confusing, so review this and other videos anytime you have questions regarding your recovery. If you still have concerns, reach out to our team for help. This process is routine for us, but we realize this may be your only time recovering from a joint replacement, so please allow us to help throughout your recovery. If at any point you have concerns or questions and are unable to get a hold of our team in a timely fashion, I have provided my personal cell phone to you that can be used 24 hours a day, 7 days a week. You can find this number on my card, on your lanyard that was provided to you directly after surgery, or on your discharge paperwork. I may be with other patients, or in the operating room, or engaged in personal activities, so a text message is usually the best way to get a message to me. I will do my best to get back to you in a timely manner. Even though I am available 24/7, please save routine and non-urgent questions for the hours between 5 a.m. and 9 p.m., but if you have urgent concerns, please contact me directly, especially if you are considering going to the emergency department. Most post-operative issues can be managed at home or in the clinic, so please avoid the inconvenience of an emergency department visit, which is best used for life-threatening emergencies only. First, we'll discuss your surgical incision and dressing. Your incision was repaired with absorbable sutures and sealed with glue, and a waterproof bandage was applied, and an ACE wrap was wrapped around your knee. You will also have a compressive sock on the foot and ankle. The ACE wrap can be removed and replaced at any time to reduce swelling, but the bandage should be kept in place until your 2-week post-op appointment. There should not be much drainage from your incision. It is normal to have a few spots of blood showing through the bandage, but if the drainage is not contained by the bandage, please contact me directly. It may be helpful to text a picture in these cases. Your bandage is waterproof, so you can shower, but do not soak the knee in a bath or tub. The compression socks should be worn during the day, but removed at night. But if they are causing discomfort or very difficult to put on or take off, you may stop using them. In order to prevent blood clots after surgery, a blood thinner was selected for you during your preoperative appointment. It is important for you to understand which medication this is and to take it as prescribed. Most commonly, this will be a simple aspirin, but this could also be Xarelto, Eliquis, Coumadin, or some other medication. The compression socks can also help to reduce the risk of blood clots in addition to helping with swelling. During the day, get up and move for a few minutes every hour and perform ankle pumps occasionally. When you do walk or stand, do so no longer than 10 minutes per hour during the day. Use the walker for the first few weeks no matter how good you feel. The walker will help prevent falls and allow you to reduce the amount of weight placed on your leg if needed. Once walking with minimal pain and no limp, you may transition to a cane and then to no cane at all. Your physical therapist can assist you in transitioning from a walker. Use the techniques taught to you by our physical therapist prior to discharge to walk and move safely. Significant pain and swelling and bruising is normal and expected after knee replacement, especially in the first few days and weeks. It is important to use several methods to keep your pain under control. You will have pain, but the pain should be controlled well enough for you to participate in physical therapy and get adequate rest. First, you should ice and elevate the knee for 30 to 40 minutes every hour during the day. Make sure there is a layer of cloth between the ice and the skin to prevent freezer burn or frostbite. Second, elevating the leg will reduce the swelling and thereby reduce the pain and assist with range of motion. To properly elevate the leg, you should be fully reclined on a bed, chair, or sofa and use several pillows to elevate the foot above the knee and the knee above the hip. For most of the time, position the pillows so there is no support underneath the knee and thigh so gravity can assist in extending the knee. If you are icing and elevating as instructed, then you should be getting enough rest. Rest is important in reducing pain and swelling. You should only be walking or standing for approximately 10 minutes every hour during the day. Otherwise, you should be icing and elevating. Take your pain medications regularly according to this chart. First, assess your pain as mild, moderate, or severe. If mild pain, then medications such as Tylenol or Celebrex should suffice. As your pain increases, you will only add medications. If your pain level is moderate, you will add neuropathic pain medications such as gabapentin or pregabalin and tramadol. If pain becomes severe, you should add the stronger narcotic medications, which may be oxycodone, hydromorphone, or hydrocodone, depending on the medication selected at your preoperative visit. Once the pain begins to become more manageable, you should decrease the use of the strong narcotic medications in the severe category, and then begin decreasing the medications in the moderate category until you are only taking the medications in the mild category until no medications are needed at all. You should be able to gradually stop the use of strong narcotic pain medications, but everyone is different. Some may be able to do this within a few days, others in 1 to 2 or more weeks. Please notify our team if refills are needed. Requests can be done most efficiently through the MyChart program through Cadlic Medical Records, or calling the office directly. If you are in a bind and need a refill urgently, just send me a text message. You have been prescribed several different types of medications. Besides the pain medications and blood thinner already discussed, you have been prescribed a nausea medication called Zofran, also known as ondansetron, that can be used if needed for nausea or vomiting. Constipation can be common after surgery and with narcotic use, so a stool softener mixed with a mild laxative called Senecot should be taken as scheduled until you begin having soft and regular bowel movements. Only stop this medication if you begin having diarrhea. Polyethylene glycol, also known as Miralax, is a stronger laxative that can be used in addition to the Senecot up to twice per day if you don't start having bowel movements in the first few days after surgery. Occasionally, you will have concerns or questions that need to be answered by a member of our team. All numbers are listed on your discharge instructions. If it is during regular business hours from 8 a.m. to 4:30 p.m. and you have questions about these instructions, such as how to take medications, take care of the bandages, constipation, pain control, physical therapy precautions, or if you have issues with the bandage or incision such as bleeding or excess drainage, you can call Syra Campbell, our nurse navigator. For concerns with medical issues, such as persistent nausea or vomiting, severe diarrhea, signs of bleeding such as blood in your stool or urine, or nosebleeds, unusual fatigue or dizziness, difficulty with urination, you may call Nicole Smith, our nurse practitioner. If after hours, you can call the on-call provider or contact me directly via cell phone. For life-threatening concerns such as difficulty breathing, chest pain, or loss of consciousness or severe stomach pain, you may call 911 or go to the emergency department, but please notify me if this occurs as soon as you are able to do so. Again, most issues that arise can be addressed over the phone or in the clinic, so avoid using the ED unless you are having life-threatening conditions. In summary, keep your bandage on until your 2-week follow-up appointment. Take your blood thinner. Control your pain by icing, elevating, resting, and taking regular pain medications. Use the walker, be safe, and don't fall. Allow our experienced team to help you through your recovery, and avoid unnecessary trips to the emergency department. If all else fails, contact me directly on my cell phone number provided. Happy recovery.